Hi, this is a presentation investigating the role of a chiropractor within the healthcare system in Canada. Hopefully this will answer some questions regarding the chiropractic profession for people who are unfamiliar with chiropractors and bring to the front of people's minds where and why they might seek chiropractic treatment in Canada. Now, there's 6 people that were involved in this project: Bradley Abel, Jaspreet Sandhu, Jim Gilliard, Matthew Messia, Michael Fahim, and Teresa Lisk. I'm Jim Gilliard, and the title of this project is Chiropractic Today. Are you missing out? We're going to be talking about chiropractors in Canada, a far-reaching, multicultural country where access for all is one of the pillars of society. Perhaps one of the strongest Canadian pillars is the provision of simple and affordable public health care, something everybody can be proud of, and know that the government-funded program provides some of the best health care in the world for Canadians. But with the national population of 34.5 million and growing, Canada is quickly needing to identify and provide easy access to appropriate facilities and professionals that provide the most effective health care to serve everybody and still make it affordable. While Canada has always demanded quality health care and practitioners that have the best training available, as the population continues to grow, there needs to be effective solutions to lessen the financial burden placed on the system Canadians love. So where are Canadians turning in order to get such quality treatment? Well, they're starting to turn to chiropractors. There's 4 fundamental keys that make chiropractors important for future medical models. Chiropractors are rooted in evidence-based care, making decisions based on the most recent medical literature available. They have a level of expertise in musculoskeletal health unrivaled by other health professionals. They develop patient-centered models of care, engaging patients from beginning to end of treatment. And finally, they empower patients to make functional change and maintain good health. So let's talk about evidence-based care first. Evidence-based care is important to people, and it's clear chiropractors have embraced this concept by the significant rise in alternative healthcare use in North America. Currently, there are greater than 600 million visits to alternative practitioners per year in North America alone. Medical doctors are also referring patients with non-life-threatening conditions to professionals like chiropractors more and more each year. Research continues to grow, and chiropractors could be found at the forefront, pushing the boundaries of our knowledge forward in many reputable scientific journals, particularly as they pertain to musculoskeletal conditions. And that's where you'll find chiropractors specializing in helping populations manage painful conditions and progressing back to quality health, musculoskeletal conditions. Now, while chiropractors are well known to be specifically trained to perform an adjustment or high-velocity, low-amplitude spinal manipulation, they're certainly not limited to this one form of treatment. In fact, they're often well-trained in various forms of mobilization, soft tissue release, massage, acupuncture, and other types of therapy. Now, for clarification, musculoskeletal conditions can include things like muscle strains, joint sprains, arthritic conditions, frozen shoulders, and, of course, low back pain. And that's what the condition that really stands out in chiropractic: back pain. And it's largely due to the expert care chiropractors can give for this condition. Now, consider some numbers. 80% of people will suffer from low back pain at one point or another in their life, while 30% of people are suffering at any given time. Chiropractors are a great resource for overcoming this pain, and many people have found seeing a chiropractor significantly helps them get back to do what they want quickly and pain-free. The next one's holism. And holism is something chiropractor has embraced as it relates to treating patients. A holistic approach embraces the concept that health is influenced by a wide array of factors, including psychological, physical, social, and environmental, and that all these factors should be considered when diagnosing and treating patients. This includes from what you eat and drink to the daily commute and business stressors of your life, family dynamics, and of course money concerns, as well as many more. These factors don't necessarily cause disease, but can contribute to problems negatively and influence the success of a treatment plan. Using a holistic approach with patients is shown to provide a greater quality of health care and reduces the total cost. But more importantly, this approach better generates good health outcomes for the patient as well. Finally, chiropractic treatment has long been involved in preventative health care, particularly as it relates to staving off conditions like sore backs. Similar to maintaining a car, by getting assessed by a chiropractor, muscles, bones, and joints can be assessed to ensure they're functioning correctly. If they're not, even if this happens before any pain is apparent, problems can be corrected before they lead to more significant injuries, and things can get moving again. Now, a chiropractor may use some of the manual techniques discussed earlier to help with these conditions and make the corrections, or they may utilize education, rehabilitation, stretching, and activity modifications to prevent injuries from occurring. Ideally, any preventative measures will empower patients to actively become involved in their health, taking suggestions from the practitioner and applying them in their everyday living. Based on these four foundations, evidence-based care, expertise in musculoskeletal conditions, patient-centered approaches, and maintaining long-term health, chiropractors provide Canadians with effective and affordable health care. And if we had to end with some type of slogan, well, I guess we'd say, spend less time in pain and more time with the people you love. Next time you're in pain, why not try seeing a chiropractor?